So a few months prior to coming to Sunrise Urology, I visited another urologist where they attempted to perform a vasectomy. Ultimately, they failed.
Hello, my name is Dr. Lin from Sunrise Urology. In this video, you will hear from a patient who went to another urologist who then attempted a vasectomy on this patient. Unfortunately, it was unsuccessful. Sometimes experience does matter. Let's check out the video.
Most of my patients who undergo vasectomy are fairly standard, pretty straightforward. They come in for their initial evaluation, they have the procedure, and they're done. However, Nathan's a little bit, his situation's a little bit different, and I want to have him recount his experience and his story with you.
So a few months prior to coming to Sunrise Urology, I visited another urologist where they attempted to perform a vasectomy. Ultimately, they failed.
What do you mean they failed?
He said he could not access my vas deferens, and he wanted me to come back and to undergo general anesthesia and be operated on. My recovery from his attempt was not real pleasant, so I had reservations about coming back to see him, going back to see him. Dr. Lin was referred to me by a couple of friends who had previously visited him, and so I came to check it out.
Okay, and on your initial evaluation, what took place?
I was evaluated, and Dr. Lin didn't have much concern or doubt that he would be able to successfully perform the procedure.
And did I do anything to demonstrate to you that everything seemed normal?
You showed me where things were located and that they were more or less normal.
Very good. And then you mustered up enough courage to come here for the actual procedure.
Right.
Tell us about that experience.
We just finished 45 minutes ago. Everything went pretty well. It only took 5 minutes, give or take. It was all good.
And that is fairly typical. It doesn't usually take a long time for someone who's done a lot of these procedures. Compare this experience to what you experienced before?
Better, successful. Knowing that I don't have to come back or possibly undergo general anesthesia and surgery. Everything was seamless, smooth. There were no issues.
Well, for most patients, what you went through is typical. It takes less than 10 minutes for someone who's done a lot of these to perform the procedure, and everything goes smoothly, and then afterwards you just have to get your semen tested to make sure you're truly shooting blanks. And it's typically not a struggle to find your vas deferens unless you've had some anatomical abnormalities, which you did not. So everything went as planned.
Agreed.
You were offered general anesthetic. What type of anesthetic did you have this time?
Nitrous, laughing gas.
Okay, and what was your experience?
It's only the second time I've used it. It's a unique experience. I did it largely just to try it out. It was a little trippy, but I think effective.
And you were able to go through the procedure without general anesthetic, which would have been more costly and with a slightly increased more risk.
Yeah, I think it was a good alternative.
Well, very good. Now that you are through the procedure, any parting thoughts?
No, not. Yeah, we're set, ready to go. Happy with everything.
Well, very good. I will tell you that I was not very good at doing these procedures when I first started. It would take me half an hour. I was using a scalpel before, but over time I kept honing the technique, and that's how I'm able to do it so quickly and so efficiently and provide a great experience for the patients.
Well, thank you for that great experience.
Well, thank you for sharing your story.
My pleasure.